The Medical Association of Jamaica is calling for a review of the security arrangements at public health facilities across the island. This in light of the recent incident at the Cornwall Regional Hospital in St. James on Monday, where security breaches occurred. Shamela Pullen has this primetime news follow-up.
Days after standoff between relatives of a patient and medical personnel at the Cornwall Regional Hospital in St. James, the staff remains on edge. Many said they feared for their lives after allegedly receiving threat from the people who demanded release of the patient. The incident has reignited debate about security issues at public health facilities. President-elect of the Medical Association of Jamaica, Dr. Leslie Mead, says there have been several incidents like these.
Over the years, we have seen where these sort of breaches have been occurring from time to time, when persons would either come on to the hospital plants, either to get to their rivals, whether to finish something they may have started earlier, or to take patients away.
But Health Minister Dr. Christopher Tufton argues that the Ministry of Health has provided a fairly robust security arrangement at public health facilities across the island. He considers this adequate enough to protect healthcare workers.
We spend millions, hundreds of millions of dollars each year to hire private security firms. And we work very closely with the police. And in many cases, there are electronic devices that provide additional security. So, we're always willing to review if there seems to be any vulnerability in any area. Clearly, the matter yesterday could have been worse if there weren't security and if the police weren't summoned and they responded. So that demonstrates that the system works.
But Dr. Mead believes the current system can be improved.
You must have different levels of security, all right? So I know, for example, at Kingston Public, there was a police post at one point, so that if it is that there are individuals with weapons, whether guns or otherwise, that you have that deterrent so that they may not come onto the plant. Similarly, when you have security on hospital compounds, there must be different levels of security.
The health minister acknowledged that a review of the current measures should be done. As for the Cornwall Regional Hospital, it is now being contemplated whether immediate changes will be made at the facility.
A conversation has taken place about that possibility if needed. I've not gotten a response on how that conversation ended. But again, I say where that is needed, we are more than willing to do that because the safety of our staff comes first and they need to be able to do their work without fear. So I know that review was taking place. But again, I say we do have a fair amount of security presence on the ground in all our institutions, particularly our hospitals, and Cornwall will be one of the more significant ones.
Shamela Pullen, TVJ News.